And we are live. Hello from Houston, Texas, at least in this tile of your screen. My name is Simmy Hundal. I am an organizer of a grassroots event called the March for Unity, Civility, and Political Engagement. And with me here today, I have three gentlemen that are thought leaders in their respective spaces, here to speak about the theme for the month, which is civic duty. As a brief way for me to think about civic duty, I think about the JFK quote, think not or ask not what your country can do for you, ask what you can do for your country. And we will be thinking about and speaking about the latter of that phrase, of that sentence. So I will dive right into that after I introduce these three gentlemen coming from different points and around the globe. I'm going to start west to east today, as opposed to the east to west that we did yesterday. So why don't we start with Tim Lee, who is a thought leader in the health insurance space. He is a thought leader of a health insurance carrier based out of Atlanta, Georgia. Tim, thanks so much for being with us.
Hey, thanks, Simmy.
For sure. Moving a little further east, we have Christopher DeVore, based out of Washington, D.C. He is a legislative assistant for Congressman Sablan, based out of the Northern Mariana Islands. Thanks so much for being with us, Christopher.
Happy to be here, thanks.
For sure. And moving very far east, across a hemisphere, if not more, we have Ben Gleiser, based out of Wellington, New Zealand. He currently is the founder and CEO of conscious consumer app CoGo. And he also is an economist, environmentalist. And I'm so happy to have you here with all that experience. Thanks for being here, Ben.
Thanks, Simmy, and hello everyone from 9 a.m. New Zealand.
Very cool. I'm so glad you made time for us. So I'm gonna jump right into the preset questions that we have for today. And Ben, I wanna start with you. We have mainly had, with the exception of last month, people from the US speaking a lot about key issues. One of the most important issues has been COVID-19, with the world, much of which has been in lockdown. US has definitely been struggling, but New Zealand has shined compared to other countries in terms of the response, lessening the amount of death, the amount of cases in New Zealand, and really having quite a positive reaction and a positive take response to COVID-19. Could you speak a little bit about what 2020 has been like in New Zealand? What were the lockdown measures? What was the social distancing measures, school closures? Are Kiwis content with the response, or are you all happy? Can you talk about that?
Sure. I actually start with where I was at the beginning of the year, which was in London. So I was living there for 2 years. The plan had been to leave the UK in July to come home. I have a wife and 2 children, and in March this year, we were in London thinking, oh, well, we'll be here for a few months. But within about 4 days, we'd packed up our entire house. We'd taken the kids out of school. We'd shut down physical office, because in London, they went to lockdown around March 2025. And so we were like, right, we're out of here. So actually my experience of COVID and the experience of sort of civic duty in the UK was an interesting experience. It definitely was one that was a bit more divided, a bit more, I don't know, there wasn't a coherent message from the sort of government sort of bodies. And the difference is we arrived to New Zealand, right? So we literally escaped off of what felt like a bit of a burning ship and flew into New Zealand. And the first thing that you walk out from the airport and see are 2 messages. The first one was, let's unite against COVID-19. And the second was, be kind. And the unity that I see here in New Zealand is probably the defining sense that has united the country around a response. And so you talk about civic duty. I think in New Zealand, I just saw a stat this morning, 99.9% 9% of people are wearing masks on public transport. There's been literally no fines handed out. So the people that haven't have just forgotten, for example. So we do have some measures in place around, you know, I guess supporting the control of the disease, but there's been absolute unity. Like I think something crazy like 85% of people in New Zealand are supportive of the measures that the government have taken. And I suppose what that was we arrived on the 20th or 22nd, I think it was, of March. And in New Zealand at that point, there was about 8 cases. But quite quickly in the days after, it started to ramp up. And we were actually on a trajectory similar to Italy. So the growth rate was actually quite bad right early on. And what the government did is they came out and said, like, we've been messaging you about uniting, and here is a chance. And they talk about a team of 5 million. So the language is all about bringing people together. And we went into a lockdown, which basically was one of the strictest in the world, where you effectively had to stay in your home unless you were going for emergency supplies or food. And in those situations, very strict 2-meter social distancing, masks and everything. So New Zealand did go hard. That's the expression here. We went hard and we went early. And we spent what was about 8 weeks in the end, literally in our homes. And by about week 12, when they slowly brought people out, we had completely eliminated the virus, as in there was not a single person in the country tested positive. So we sort of did a sense of we're all in it together. And if we all pull in the same direction, we will get the result. And then week 12, we're out eating, drinking, and we can go out and enjoy friends, and we can do all these things now because it felt like a real team effort. It felt like a thing the government was messaging really well on. Everyone got behind, and ultimately we're now sitting here. We do open borders now, so we have got a lot of cases coming in from the borders, but we control and have amazing contact tracing. And I guess it feels like a sense of, combination of good comms, unity, and ultimately we're now here enjoying life in normal offices, drinking with friends, and feeling pretty confident really in the institutions that are supporting us. So that's my take on what life is like here, but it's generally good.
That's amazing. I could spend 45 minutes just talking and asking more questions about the progress of New Zealand, but I'll keep it to my immediate response to what you're saying. I was going to wait till later to try to impress you with this phrase, but it comes to mind. Kia ora comes to mind in that response, which I found is a greeting in New Zealand, which means have life. And I think it has deeper spiritual meaning. And I think that came through, that type of spirit came through in the response, with everyone uniting and thinking about the implications of what they're doing every day.
Yeah.
Thanks so much, man.
No worries. Yeah. That message of civic duty, we don't use that phrase here, but ultimately I think it was an exemplary display of civic duty by the people of New Zealand.
It's amazing. A lot to learn. Thank you for that, Ben. I'm going to rotate to Christopher, going west from east now. Christopher, here's the question that I have for you, especially with all the experience that you have in DC and in public service. There are differences between the rights and privileges of citizens in the 50 states of the US versus districts/territories. For example, Medicaid, a program that helps with medical costs for people with limited income, offers federal dollars to states based on income levels and healthcare needs, but US affiliated insular areas like the territories of Puerto Rico, the US Virgin Islands, and the Commonwealth of Northern Mariana Islands that you work for are capped in Medicaid funding. For those of us that are privileged to live in states, we are the beneficiaries of these rights and uncapped programs. Are the differences justified between the status of the state versus the territory/district? Why or why not? And what should be done if they're not justified?
Well, I think that's a simple question to answer. They're not justified at all. Historically, if you look back at why the caps are set at the level they are, there's a footnote, a little known footnote in a law that more or less suggests that it was based off population. And I think that's a terrible metric to go off of, because the populations of the territories are respective to states very small, Puerto Rico being the exception. And, as those populations have then since grown, the cap has been more or less the same, growing at some small rate of inflation every year or so. And so look, Medicaid is a safety net program, right? It helps people access healthcare, especially when the economy takes a turn for the worse. We are seeing that now across all the states, especially with the economic impacts of the coronavirus. That more and more people are enrolling in Medicaid. It's happening in the territories, and it's certainly happening in states. And Medicaid is the largest state expenditure out of any state budget, probably next to education as a close second. And, for states that are struggling to fund Medicaid on a normal basis, a sudden influx of hundreds of thousands, if not millions of people is really putting a strain on state budgets, especially in the territories. And when you're a territory that has a capped Medicaid budget, there's a limit to the amount of federal funding. Just last December, Congressman Sablan was able to negotiate a 2-year deal for Medicaid funding. For the Marianas, we increased our rate from like almost sevenfold to $60 million. And even that's not enough to cover our annual costs, especially now considering that we have thousands of more enrollees almost since February. Which the system just can't handle that. And when they run out of money, what happens? They have to shoulder the full financial burden of that, and they just don't have the funds for that, especially considering the territories, many of them, like U.S. Virgin Islands, tourism-based, and the tourists aren't coming. And so if you have depressed general revenues, you can't fund the Medicaid program. You just can't, even with the cap. And the cap is putting a tremendous strain on it. So the simple answer to your question is that the caps need to be removed. There needs to be, these are Americans too. Granted, they have different rights when it comes to like voting and things like that in federal elections, but at the end of the day, they're U.S. citizens. There's, with the exception of American Samoa, who are American nationals, U.S. nationals, but for the most part, American citizens. And they should have the same access to healthcare, especially from our safety net programs like Medicaid, as any of us would enjoy here in the States. And they just need to be treated fairly with that with respect to that. And the other thing that, you didn't mention it, but the FMAP, the Federal Medical Assistance Percentage, that's the real crux of the issue here, in addition to the cap, is how much the territories are contributing versus the states. And prior to this 2-year deal that my boss was able to negotiate, the states were statutorily limited to 55%. Now let's put that into perspective. California is by itself the 5th largest economy in the world, right? They contribute, their FMAP is set at 50%. And FMAP is based on per capita income per person and a couple of other metrics. But essentially, every 50 cents on the dollar, California is contributing because they have the means to do so. But when you consider a territory, ours were set at 55%. The poorest state, Mississippi, was around 73%. And even they have more economic means than any territory does. And so it's just, it's just simply not fair that the territories have been treated this way for so long. Capped Medicaid program and a statutorily set FMAP is not how healthcare systems get stronger. We're almost intentionally underfunding healthcare for American citizens in the territories, and that needs to change, and that needs to change now, because COVID-19 will eventually end, hopefully, but it's not going to be the last pandemic. We've been talking about what the next pandemic is going to be since H1N1 back in 2009. And here we are with COVID-19, and COVID-19 will eventually go, and there will be something else along the way. And hopefully by then, we will have lifted these intentional policies that ensure that people that live in the territories, American citizens that live in the territories, don't have access. We need to get rid of that, and we need to provide parity to these people.
Well said, and thank you for bringing FMAP to my attention as well. Something that I'll look into. But yes, as you were saying, if it's still underfunded after fighting for 7x what the budget was prior, and you're still underfunded, it's a scary thought to think a couple of years back if something like COVID-19 hit the Northern Mariana Islands.
Well, they increased a little bit. They gave us the Family First Coronavirus Act. That's if you're counting how many relief packages, that was number 2. So the second relief package increased the territorial budgets by about $4 million for the first year and $3 million. And really that was to cover the cost of testing. You know, granted, tests weren't widely available then anyway. But, you know, so for this fiscal year, which ends at the end of this month, we will have had a total of $64 million to spend on our Medicaid program. Next year, slightly less at 62. But then what happens after that? We go back to the 8-9 million. That's just not going to work.
Thanks for that, Christopher. And that's something for us to think about in the States. As you said and indicated, there's some rights that we have, voting rights as citizens of other states, that people in the territories may not have, and something that we should keep in mind when we speak with our representatives to push for our fellow American citizens in territories. Thanks, Christopher. Tim, let me go a little further west to you, based out of Atlanta. I'm going to approach this more so from the perspective of what Americans and people around the world can do personally in their lives as citizens and what their civic duty is. We just heard from Christopher about potentially what we can do when speaking to our government officials. But let's talk about our personal lives. The United States has the dubious distinction of being the country spending the most on healthcare as a percentage of GDP of any OECD country, 17%, by a significant margin compared to the next highest spender, Switzerland. At the same time, the life expectancy of Americans is 78.6 years, which is below average compared to other OECD countries. 2 questions for you. What can the average American citizen be doing today to improve health outcomes and decrease the cost of healthcare? And 2, what innovations do you envision disrupting the cost and efficacy of healthcare?
Yeah, those are pretty good questions. So to your first question, I would kind of break that up into twofold. So when you talk about improving health outcomes, there's some immediate things you can do. So for example, flu season is upon us. So if you're someone that's watching this monthly, viewer, or if you're just, perusing by, please get your flu vaccine. Really important this year. That's something that you can immediately do as an individual and also protect those around you and those that you love. Another thing that you can also do is have your annual physician screening. So every year you should typically be going to your provider to get a screening if possible, to make sure that everything about you is healthy and making sure that they can help monitor your health and your well-being. So those would probably be 2 things you can immediately do, but some other stuff that you can do as just an ordinary individual is work on your diet, right? So limit the amount of, McDonald's, fast foods, things like that if possible. Exercise, spend more time outside, less time watching Tiger King or Mulan. Those things will help. And then also just really behavior too. So do you smoke? Do you vape? Some of these things for younger individuals, it seems cool, but when it comes to talking about your health, it could be detrimental when you think about it in the long term. But then also when you're talking about decreasing costs, I think Christopher might be more of an expert from the macro level, because I think there should be an intertwining of both the macro and the micro level. So like on the macro level, there's things that the system could do better. For example, increasing funding for public health services or long-term care facilities. But on the individual level, I would say probably the most important thing is around health literacy. So health literacy is actually really simple and very easy, but it's something that we don't really talk about all the time. And so basically what health literacy means is the idea that when you're presented some information that is medical or clinical related, can you interpret it correctly and can you actually do the correct action for it? So, you know, do you know what a copay is? What is a deductible? Are you comfortable with filling out your own medical forms? Things like those are really important, but yet, according to HHS, 88% of all Americans are not proficient in that. And that costs the healthcare system roughly about $240 billion per year in unnecessary hospital expenditures. And that doesn't really even account for things that are related towards avoidable hospital readmissions and hospitalizations and a slew of other things. But when you boil it all down, it really does come back to health literacy, whether or not people can understand what is happening to their body, and also kind of what do you do when you have certain information. So that's really how to kind of approach the first question that you proposed. And then the second question about kind of innovation. So addressing things like health literacy right now within the private sector space, at least, a lot of companies are working with artificial intelligence, machine learning, and data. So a lot of these big buzzwords that people talk about, but what they're all trying to do with these technologies is really inform consumers and citizens like us about different decisions and basically making some of the medical benefits and medical coverage and also medical explanations simpler and easier so that we understand what it means, right? Just like when you were in middle school or elementary school, I'm sure people sometimes said to you, hey, your epidermis is showing, right? And then people would freak out and, oh my gosh, what's my epidermis? Like what part of my body is showing? Like it must be something really inappropriate, right? But what people didn't understand was that the epidermis is just really your outer skin. And so that's just a really simple, but you know, funny thing that they're trying to do right now with machine learning is how do you simplify some of these medical explanations or medical terminology into something that's simpler for you to use. And so really those two things, I would say AI with ML, but also data. How do you use the data to connect people together in ways that you were not necessarily able to do? And so just one last point is, you know, when I'm talking about diet or behavior or exercise, right? Right now, we don't really use that information or that data to kind of make decisions about who you are as an individual or how healthy you are. Now, imagine a couple of years down the road from now, you can use that data to better understand your patient population, who's around you, and the health of those in your community. And so those are just some really important things that are happening right now, but it takes a little bit of time.
Thank you for that, Tim. And that's something that I can relate with. Maybe not the epidermis thing. I was able to rack my brain for a few seconds and was able to get it before you explained it to me. But generally speaking, recently going to a doctor's visit, you hear terms, you hear prescriptions, you hear of things that you should be doing. And then I immediately go back and I search on WebMD or the like to figure out what they were talking about. And being able to explain that information in a digestible manner to those individuals on their level can make a big difference, especially when you scale it, as you said. Christopher, you were making the money, money, money sign. I look like Johnny Football a little bit. Do you want to tag in for a comment?
Hopefully not like Johnny Football. Didn't he wash out? No, but Tim hit that right on the nail on the head, I guess is the phrase. Health literacy that's funding public health in general, and health literacy is one of the things that this nation ought to invest more time in, and that boils down to just education. We chronically underfund education. I mean, you can look across how states do their budgets, and whenever there's a deficit, what's the first thing to go? Education. You know, we don't pay teachers enough. We don't attract the best teachers. We need to pay them more. And we need to, you know, increase access to education, and we need to, you know, across the board, just invest in education. And that's something we're not doing. And as a result, we're underfunding healthcare, and we're expecting, you know, millions of people to, on a moment's notice, adhere to public health directives. The very nature of those directives is to limit mobility and restrict liberties, and we get pushed back for that. You know, wearing a mask is too much to ask for to control the spread of a virus that's airborne. It's health literacy is really lacking across our nation, and that, you know, just you don't have to look too far to see where we could make improvements, and we're just not doing that at the federal level, at the state level. That's something that we should focus on, I think, and especially, you know, from the federal level when we're making grants. I mean, health literacy is just one part, and you know, that kind of is part of the bigger picture of, you know, social determinants of health, where you're born, you know, access to education, access to healthcare, those types of things that really determine how adverse health events might impact you as an individual based on where you live. And, you know, if we were more thoughtful as policymakers, as state officials, if we're more thoughtful about creating programs that considered social determinants of health in any grant program or any kind of funding project, I think that would go a long way into improving education and health literacy and overall the public's health, so that we wouldn't have to resort to things like recommending, you know, everyone wearing masks or restricting movement and that sort of thing. Those are really latch-ditch efforts that come out of not planning and not being prepared. And even then, we haven't had quite great a success as, you know, our friends over in New Zealand have had. I mean, look, as of today, we've got 6.2 million cases, cumulative cases, really. And that's wild, you know, 188,000 deaths, cumulative deaths. This was all preventable. And health literacy played a role. Our lack of preparedness, our constant underfunding of our education and public health systems played a role in how devastating this virus pandemic is in the United States.
Sounds like a private-public partnership that might be brewing between Tim and Christopher, hopefully, for health literacy in the future. Thank you, Tim and Lee, for that. Ben, over there, you may have been rethinking your investment into America after some of the comments we've been making about America's response. Okay, great. I'm glad to hear it. Because I want to turn to you on the business end. We heard about individuals interacting and engaging with government to enact their civic duty. We talked about individuals in society, what they can be doing both for their own health as well as lowering costs across the healthcare industry. I want to talk to you about companies. What is companies' responsibility in society? Because that's something that your company and your app highlights as part of its offering. So this is my question to you. CoGo, the business you started in New Zealand and then the UK, as you described, enables consumers to track the impact of their everyday purchases on issues like their carbon footprint or supporting living wages, and discover new businesses to patronize based on these issues. What civic duties are conscious consumers demanding of their brands and retailers? In other words, what trends have you seen regarding the issues that consumers care about over the years?
Cool, yeah, happy to answer. I'm actually going to mix it up and show a few, 3 slides just to give you guys a bit of an idea. But I'll start with what I was doing maybe 15 years ago. I did my master's in economics and went into government. So I guess I started my career around how do we create systemic, positive social environmental change in government. So worked as an economist, and led a whole lot of stuff around social investment, around health reform, but also around how we measure progress in society. So looking beyond simple GDP metrics to more like health outcomes, distribution of health outcomes, all these, river water quality and stuff. So a broader measure. But I think after a few years in government, it's slow progress. Like they definitely, even now the New Zealand government has finally decided, look, we want to lead the world in what progress should be, and it should be not measured simply on GDP per capita. And they're using the framework that we built at Treasury as the underpinning. So I feel like progress is made at the government level, at least in New Zealand, but in many ways, people point the finger to government for these solutions. It's funny that the phrase that you said at the beginning, like in many ways you can point the finger to government, but actually we all have a responsibility to help shape the future, right? And I'm going to tell you a little bit about an idea we started while I actually was an economist at the Treasury. So the idea is called CoGo. It's a technology platform using data, machine learning, a whole bunch of these cool buzzwords. But really, it's a platform that's trying to solve some of these social and environmental issues that you see here. I think there's a growing awareness of these. I mean, California at the moment is a terrible state, whether that's environmental on plastics, whether it's inequality, whether it's around poverty. I think government can solve and will be part of the solution, but we're a platform that helps empower individuals and businesses to be part of the solution too. So it started way back 2011. Me and my partner at the time and best friend, Melissa, started this thing called Conscious Consumers as the original tagline. And we were trying to promote businesses that were taking action around social and environmental good. So it's a free app. You downloaded it and found restaurants nearby that were paying decent wages, or supermarkets that were selling vegan, or whatever the issues that you care about. And the question you asked to me, we started in New Zealand, launched in 2011, and the whole premise of the product is to help align people's spending with their values. And what we did, launched in the UK last year, is we integrated with a thing called open banking, which effectively is an open data concept. So your bank currently has all your banking data and sells it to marketing companies and things. And open banking is a regulation now in Europe where you have the rights to your own banking information, and you can share it securely with people like us. And how we use this data is we start by asking you, what are the social and environmental issues that matter to you? So what are your values? Do you care about people being paid a decent wage, or are you particularly worried about plastic pollution, or worried about climate change? What are the specific things that matter to you? And the question on the trends is that we've seen issues like climate change in the last 2 years, massive growth in that as an issue. Prior to that, we saw a big push around plastics and waste. And then social issues like decent wages for living. The living wage is a wage that sits above a minimum wage. It's defined as a wage that is suffice to actually have a life rather than just a minimum. So then the platform aggregates, we have about 30,000 businesses. I should say this is UK and New Zealand, coming to America soon. We aggregate all the existing certification accreditation bodies to provide, I guess, a directory of businesses. So say you care about the living wage, you'll be able to find a cafe or restaurant, whatever, around wherever you live that pays decent wage for their workers. And that's like a Google for good business, I suppose. But with open banking, we securely connect any major bank, credit card, any data that exists in your financial sort of system. And we can then tell you how much of your spending is with businesses that pay a living wage. So in this example, it's called a living wage wallet. We can let you know that in the last 6 months, 10% of your spending is with these businesses that pay the living wage. And we can also then nudge you to say, well, hey, we use behavioral science to try and take people from a particular set of spending patterns to nudge them to be like, hey, we can see, hey, Tim, you told us you care about living wage. You're with an energy company that doesn't pay one, but we know, there's 10 others that do. How about you move? Or why don't you go and grab a drink at a bar that pays a living wage? There's hundreds of other people that are doing that in your community, and this is the spending they're doing in the last weekend. So trying to use sort of behavioral science to nudge people to actually align their spending and values. The last thing just to say is we're really happy about a new feature, which is about your own personal carbon footprint. So we analyze all your banking data and we tell you what your contribution is to climate change. You know, governments are slow on this, and I think we all have a civic duty to take action and support businesses and types of businesses that have lower footprints. So you can offset your emissions, and we nudge you to say, hey, you emitted that much last month, why don't you support a community project planting trees or doing work to actually reduce your footprint? And finally, we recognize people's existing behaviors. So if you're buying for secondhand clothes, if you're driving electric cars, if you've got vegetarian or vegan diets, we'll recognize you and show how you are part of a community that are also taking these actions to reduce their emissions. And ultimately, the idea behind this is that if we can bring together citizens on a sort of mission that, like, we are all caring about particular issues. If we can say, well, look, there's other people that care about these things, we're all having a personal impact. And ultimately, the tagline we sometimes say is, let's go change the world. That's all I'll say. Happy for questions, but we're looking forward to bringing it to the States next year.
I hope you do. I know open banking has definitely made your journey easier in New Zealand and the UK. I hope the US is able to continue along that path. But just initial response, of course, is continue the good work. It's an amazing app. And I think the real power for me as a consumer is that I can see and not just enter into my phone or enter into my device manually what I'm buying, where I'm buying, but you're able to actually put the spending against a database of vendors, of companies, and tracking what standards and what type of trends, what type of practices they have to actually work towards the causes that matter to you.
Yeah, I mean, I don't know, more and more, I think people are looking for solutions. You know, they see these issues, inequalities, they see issues around climate and things like that, and they're looking to feel a sense of purpose in their own choice. This obviously isn't for everybody. You know, you need a certain level of discretionary income, but even those people that are on the lowest of wages, I'm sure they'd like to make sure they can support a business that also, you know, pays a better wage to their workers. So we do feel it's a trend that is massively growing, and these issues are not going away. So we're keen to collaborate and work with others in this space. So yeah, it's coming. And open banking, yeah, it'll work in the US. We've got a partner that can connect into most of the US banks. And so yeah, get ready.
Good. I'm glad to hear that. You already prompted the audience. I hope they take that to heart. If you have any questions for these three panelists, we've already had one come through. Thank you for that. If you have any questions, please click on the Q&A icon at the bottom banner, and I will try to get those questions to them once we finish our next section, or at least touch on that section, because we're running a little bit behind. So I'm gonna go through the next section, which is the I agree / I disagree section, to have some civil disagreement, try to get to the heart and some of the heart of differences between some of the opinions on this panel today. So I'm gonna start with the theme of civic duty, and I'm gonna ask each of the panelists if they agree or disagree to the opinionated statement that I mentioned. Let's go west to east this time. Every eligible voter has the civic duty to vote in government elections. Tim? Agree, disagree?
Sorry, I get confused with you going west to east all the time because I'm thinking relative to which point.
True.
But yeah, right. Right, but I would agree. I agree with that statement.
Thank you. Christopher?
I also would agree with that.
Great. Ben?
Yep. Agree. Okay, unfortunately, it's not trending the right way, but I'd agree.
I hear that. Next statement. It is acceptable to disobey a law if your associated action will not get you caught or convicted. Tim?
Geez. Yeah. I probably would say I would agree with that statement.
So just to confirm, you agree it is acceptable to disobey a law
Correct.
if you're associated action. Okay, got it. Christopher, agree, disagree?
I'm gonna buck that one a little bit. You know, it's very broad. Obviously, you know, we should as citizens follow the rule of law, but there's also a lot of laws that are bad and should be repealed and revoked. You know, I think that it's great to disobey if you are going to get caught, you know, intentionally, you know, as the late, great John Lewis would say, make good trouble. And so it really depends on the case, and it shouldn't be black and white like that.
Okay, so what about you, Ben?
Yeah, I'd say in most cases, it would be great if we had lawmakers that were making laws we could all abide to. But in some cases, I think there is some civic duty in calling out stuff that is not good, whether you're caught or not, I suppose. So yeah.
Sure.
On the fence.
Not a simple, me as the moderator, I think I was rebuked for making it just agree or disagree. Tim, do you want to expand on why you agree with that statement, just as the other two gentlemen have?
Yeah, I mean, I think Chris and Ben also said it pretty eloquently. It's not really black or white, but I mean, it also depends on which industry, right, you're talking about and what's happening. I mean, if you look in healthcare, we have rules in place that are a little bit out of date sometimes. And so, you know, doing something different or doing something that is a little out of the box, I guess you can perceive it as being inappropriate or breaking the law, but sometimes it's necessary in senses, right, to kind of test the barriers and test the boundaries a little bit so that we can get a little bit better. So that's kind of, I guess, my answer to it, but I would agree with Ben and Chris on that.
Okay, good. Well, we are just about running out of time. I appreciate your answers there. I wasn't expecting it, but I appreciate you diving into that in greater detail. I want to give each of you 30 to 60 seconds to give a plug, if you so desire, before I wrap it up. So I'm going to start from the person that's farthest away and then move it closer to where I am, maybe east to west. So let's start with you, Ben. Thank you so much for being on. I know you're very busy as the CEO of CoGo, now trying to expand into America starting next year. So thank you so much. Would you like to share anything beyond that?
The plug is, yeah, just keep an eye out on what we're doing, but probably more broadly, think about, yeah, the choices you make every day. So individuals, you know, we're all creating the future of the world here. You know, we're making choices that impact on other people. And I guess, yeah, being conscious, you know, think about access to data that exists to make those sort of more informed choices and help others out. You know, information is power, they say, and whether it's on sort of healthcare, sort of, you know, education, or whether it's around sort of environmental impacts. Like, I'm sure the world isn't really the future we're already into at the moment. So I think we're all empowered to sort of make choices that we can actually feel confident are actually driving a future we do value.
Absolutely. Well said. Thank you, Ben. It's been a pleasure to speak with you today. Christopher, thank you so much for being on. We really appreciate what you brought to the table from a public policy perspective, as well as from a health sector perspective.
Thanks. I appreciate it. And you know, I'm not going to tell people how to vote this coming November. I mean, I'll be voting for Joe Biden and Kamala Harris, but I think it's really important for everyone watching to pay attention to local and state elections. You know, we make a big deal every 4 years about the presidential election, and it is important. But there are elections in between that happening in your neighborhood, happening in your backyard. And some of those don't get the attention that, of course, the presidential election does every 4 years, but equally just as important. And I think that everyone, you know, there's 56 days to the next election, and I think that everyone should do everything they can to make sure that they have a plan for voting. There's a lot of different things happening in the polling places, whether they're opening a lot earlier or staying open a lot later, or in some cases, in some states, unfortunately, closing down, which speaks to whomever is in charge of that state and their ability to suppress elections. But they affect everything. Every election affects everything from like traffic congestions to the environment to your right to education. These are all things that, we care about, or at least claim to care about. And so it's really important for folks to stay involved, to be aware of what's happening around them in their neighborhood, not just every 4 years when the presidential election comes around. This is the most important election of our lifetime. The truth of the matter is every election is the most important election of our lifetime, and it's incumbent on us to pay attention, to be involved. And when those people are in power, we need to hold them accountable. We need to call our representatives and legislators on both the state and federal level. We need to call our local city council members, our county commissioners, and we need to demand the change that we seek. And when they don't follow through, we need to hold them accountable at the ballot box. Or through other means. And it's really important that we not forget about that.
Well said, and couldn't agree with you more. In terms of local elections and state elections, they have significant impact on our day-to-day lives that we're looking for. Thanks so much for being on, Christopher. Tim Lee, thank you for being on. It's been great knowing you personally. Now I got to know a little bit more about you professionally, and you brought a lot of value to the table as it pertains to citizens, civic duty, and then what we can be doing for others. Thank you for being on, and feel free to have a plug as well.
Yeah, appreciate you having me on. Appreciate being able to talk with Chris and Ben. So I'm sure we'll all kind of talk sometime in the near future. I guess two things. So one is first, get your flu shot. So if you haven't got your flu shot, or you're not thinking about get your flu shot, please get your flu shot. And then two would basically be type in HHS health literacy test and see whether or not you're health literate or if you're proficient in it. They have a nice test that you can just take really quick and easy to see what's your level of efficiency. So take it, have fun with it, and have your friends try it out too. Be good for you, and if you want to save some money, that's another way to help your community and those around you. So thanks.
Sounds good. We even have a homework assignment. I appreciate it, Tim, Christopher, Ben. Thank you so much for your time. Participants, thanks for coming on, for asking questions. Tim, I saw you answering it off screen. I appreciate you doing that. You're on top of it. Until next time, we'll have another March for Unity, Civility, and Political Engagement, the last one actually of this year, on October 6th at 5 p.m. Eastern Standard Time. And I hope to see you there. Until then, kia ora, and have a good day.
Thanks, everyone. Thanks, Chris, Tim.